Good afternoon. I'm Teresa Kelly, the Executive Director for the Health Council of West Central Florida. Welcome to the sixth session in our webinar series, Eyes on Equity Through the Social Determinants of Health. In this session, we will explore the next steps for a cross-sector approach to health equity leading to system-wide progress. This is the final session in our series and will help guide us towards actionable steps to move the needle on equity in our communities. We are excited to welcome our presenters, Matt Spence with Feeding Tampa Bay and Dr. Marissa Levine from the University of South Florida College of Public Health. I would like to thank Baycare Health Systems for their generous support of this initiative, and I also want to thank all of you for making the time to be with us today. During today's sessions, all participant microphones will be muted. You will have some time for questions and answers at the end of each speaker's session. If you have a question for the presenter, please use the Q&A function at the bottom of your screen, which will be monitored by Allison Rapp, our Special Projects Manager. Feel free to use the chat function for general comments and questions as well. In addition, you will be receiving a list of resources, copies of these slides, and the link to a recording following this session. Our first presenter will be Matt Spence, Chief Programs Officer, Feeding Tampa Bay. Matt is responsible for developing and expanding innovative programs that assist food insecure individuals in the Tampa Bay area with the goal of movement toward food security and away from the need for charitable food supports. In other words, he's trying to work himself out of a job. Programs under Matt's leadership include Trinity Cafe, school pantries, after-school meals, SNAP and other benefit assistance programs, Fresh Force workforce development, Groceries on the Go, which is a social enterprise grocery on wheels, nutrition, food RX, and additional healthcare partnerships. Matt is a two-time graduate of the Florida State University with a master's degree in education policy and a bachelor's in political science. He holds a certificate in nonprofit management from the University of Texas and has completed the Ice House Social Enterprise Training Program. He serves on the board of People Empowering and Restoring Communities, the Social Enterprise Alliance, Tampa Bay chapter, and Feeding America's Ending Hunger Community of Practice Steering Committee. He is a Leadership Pinellas graduate, volunteers with the YMCA of Suncoast, the Florida Celtic Soccer Club, St. Cecilia School, and St. Catherine of Siena Church. Matt grew up in the Tampa Bay area and resides in Pinellas County with his wife and 3 sons. Dr. Marissa Levine is a professor of public health practice at the University of South Florida in Tampa. She focuses on population health improvement and teaches leadership. Dr. Levine directs the USF Center for Leadership in Public Health Practice at the College of Public Health, and she recently completed 16 years of state government service, having served as the Virginia State Health Commissioner and led the Virginia Department of Health from 2014 to 2018. Dr. Levine previously held deputy commissioner level leadership and local health department positions with the Virginia Department of Health between 2022 and 2014. During that time, Dr. Levine was involved in the state's response to the H1N1 pandemic. As commissioner, Dr. Levine led the effort to respond to the Ebola and Zika and had significant public health emergency response efforts at the local and state levels. Dr. Levine is a retired family physician with 16 years of medical practice experience, and she received her Master's of Public Health degree from the Johns Hopkins Bloomberg School of Public Health, in addition to her MD from the Albert Einstein College of Medicine in Bronx, New York. She completed her family practice residency at the University of Virginia in Charlottesville, and she holds the position of board member on the National Safety Council. I'd like to thank you both for being here today, and we look forward to what I am sure will be an interesting and thought-provoking presentations. At this time, I will turn it over to Matt.
Thank you, Teresa. I really appreciate the opportunity to be here with you and to share some thoughts that I have around equity and our work together, and in particular, how collaboration is really, really important in this, in making this work happen. So before I get into that, what I'd like to do is share a presentation, a little bit of a conversation with you. But I think it's fair to start with, why is someone in the food world, and specifically in food relief, even here as part of this conversation around health equity. To answer that question, I'm actually going to start with two questions that I asked the current CEO of Feeding Tampa Bay, Thomas Spence. So Thomas and I have known each other for a long time. We've both been in the nonprofit world here in Tampa Bay for a decade or longer. And through that, we ended up, spending quite a bit of time together in a very wide-ranging activities and a variety of conversations. And one day over coffee, he and I were talking, and he asked me two questions that really changed my perspective on food relief and led me to where we are today. And those two questions really led me to a conversation around scale and a conversation around scope. He asked me if there were any other CEOs that he knew of in the nonprofit world who dealt with as many individuals and partners as he did at Feeding Tampa Bay. It struck me as kind of an odd conversation, and I guess it revealed my ignorance, because I thought of Feeding Tampa Bay as very much like almost any other mid to large nonprofit in the community. And then he started to explain to me the scale of the work that goes on here at Feeding Tampa Bay. For those of you who don't know, Feeding Tampa Bay is responsible for a 10-county area of West Central Florida. We are the Feeding America affiliate here, and there are over 1.2 million individuals who are in our care. Those are the food secure individuals within the 10-county region that we serve. So that number alone tells you a whole lot about scale. On the other side of that, we also have over 500 different agency partners who we work directly with almost every day to make sure food gets out into the community. We had over 60,000 volunteers come through our warehouse and various other distributions in the past year. And so when I started to understand a little bit more about those numbers, I really understood about the scale of Feeding Tampa Bay. Unfortunately, I wasn't able to answer Thomas's question because there really aren't other nonprofits of the same scale unless you take into account something like Baycare. So with that being said, it really intrigued me about the possibilities of what Feeding Tampa Bay might be able to accomplish in the community. The limiting factor in my mind was scope. Feeding Tampa Bay was all about food. For 35 years of our history, we collected and redistributed food to the community from those who had access to those who had need. And that's a noble and worthy pursuit. At the same time, it's very limited in scope. So the second question was a question from Thomas to me as well. And he asked me if I knew of anyone who would be interested in helping him build out ending hunger strategies for Feeding Tampa Bay. The idea was that as they were developing their new strategic plan, Feeding Tampa Bay really started to dig into the long-term difference that they were making. And yes, it's incredibly important to meet a need in the moment where it is. And so that's where the 94.5 million meals we put on tables last year is an incredibly relevant and important statistic. Meeting people where they are in their moment of need is who we are. We'll never stray from that. That being said, we're also really deeply examining whether or not we were actually solving the problem. As Teresa said, were we working ourselves out of a job? And with the current strategies that we were deploying, we were not. There was no real long-term benefit being delivered by Feeding Tampa Bay. We were meeting an immediate need and hoping that the folks that we were helping would then go on and be able to solve additional problems themselves. The imperative that we came forward with from the strategic plan was that we felt like we had to do more. We couldn't just provide a meal or a bag of groceries and pat someone on the back and send them on their way and hope we never saw them again. We felt a responsibility to the individuals that we serve, to our neighbors in need, to provide more. We had no history of that at Feeding Tampa Bay, and so that was really the genesis of Thomas's question. Who could come in and take on that challenge? And it got me thinking, and it may be a little bit naive, but I raised my hand and said, you know what, Thomas, I think I would love to take on that challenge. And so that's how I ended up here at Feeding Tampa Bay. It's really a question of the existing scale and the opportunity for scope. So I shared with you quite a bit, many of these numbers already. We had an economic impact study done by our partners at the EDC, and they came up with a number of over $140 million of annual impact that we provide into the community. And there are a variety of ways in which that's calculated and a variety of reasons why I believe that's at the very least accurate, if not undercounting the impact we have on our community. But those are the numbers, and again, indicative of the opportunity that we have at Feeding Tampa Bay. So that's kind of the background. What I'd like to share with you today, and I mentioned to both Allison and Teresa before we got into this, I do not enjoy presenting. I enjoy conversing. And so please, if you have questions, if you have comments, if there are things that I haven't touched on that you'd like me to, I would love for you to enter those into the chat or to put them in the Q&A. And I will certainly be happy to go a little bit off of the prepared path to have the conversation that we're all hoping to have today. That being said, I want to mention a little bit about why Feeding Tampa Bay felt like we were a good organization to enter into the ending hunger work. As a part of the same strategy that was being developed that led Thomas to the question about who could help us end hunger, we emerged from our planning process with two outcomes. We know food is our resource, right? Food is our output in many ways, but the outcomes that we seek organizationally are actually quite different. Our outcomes that we seek for the folks that we serve are health and capability. So I'm starting to steer a little more closely to why I might be involved in a health equity conversation. When we share that with the partners that we have in the community, I think there's usually a second or two hesitation to say, wait a minute, you guys are the food people. And then it begins to make sense that the things that we seek for those that we provide food for actually go beyond the meal of the day. Food is absolutely imperative. It is a critical component to overall health. Not only is it part of the social determinants of health, but also well beyond just maintaining a base level of physical health. It also can be a significant indicator of how someone is doing. It can be a significant response to different challenges that folks are having health-wise. And it's a critical component to who we are as an individual. So with that being said, health has become a significant part of our work over the past 4 years. I mentioned earlier, we have 500 agency partners. There's another 100 partners that we work with in various programs and partnerships. And we knew that in order to impact those long-term outcomes of health and capability, we would need to really deeply engage that partner network. We knew that we needed to evolve our strategy of delivering food, and we needed to focus on not just getting food out the door, but also what types of food we were delivering and how that might impact a person's overall health. So we look at a term that we call food insecurity. Many of you, I'm sure, are familiar with that, but it basically comes down to a question of whether or not someone has sufficient access to the food that they need to live a healthy life on a consistent basis. Why that matters in the world of healthcare, in some ways is intuitive, but I'd like to just very briefly touch on some specific reasons, and then we'll throw the floor open. Food insecurity matters to healthcare because it affects health status. We know that individuals who are food insecure have significantly increased risk for a whole variety of health conditions. Those health conditions are everything from asthma, from all sorts of other kind of first layer impacts, all the way through significant disease and even morbidity. So we know that food insecurity as an indicator is a pretty dangerous one for an individual. So working through, to attack the challenge of food insecurity actually has a significant impact on health. The second reason we know food insecurity and healthcare have a lot of crossover is that there are significant healthcare costs associated with food insecurity. So I'm stealing some slides here from our partners at Feeding America, but they've done some research, and $77 billion a year is spent above and beyond what would normally be expected of an individual's health costs when that individual is food insecure. You could imagine all of the ways in which we could reinvest that money, in which individuals could choose to spend that money differently, and how we could impact the community and the other side of our two outcomes that we seek, which is capability. So, here's a little more detail on that. And you can imagine, especially for those who are food insecure, this nearly $2,000 difference in annual expenditures could go a really long way to solve other problems. So I wanted to take a quick case study as to what it looks like to actually be in the food distribution world and why it's a really important moment to talk about collaboration. Because for a long time, Feeding Tampa Bay really did not collaborate at the corporate level. We collaborated with the programs that distribute food on a client level, and really we saw them as our only clients. But over the years, we have become more and more adept at delivering solutions directly to individuals. We have significant mobile distributions that we do directly out into the community. We have increased our partner network beyond the traditional food pantry and nonprofit community. And so I just wanted to share with you some of the things that occur at a food distribution. Not only do we seek to provide healthy food, but often we pair that with nutrition education, whether that's a simple recipe or a nudge in the right direction of a healthier option, or all the way out to food demonstrations and sampling. In order to do that, there are a wide variety of partners and agencies across the nonprofit span and even into the for-profit world who are significantly invested in nutrition education. And so for Feeding Tampa Bay, we had an option there. We had a choice. Do we want to directly invest in our own team to build up our nutrition education expertise? Or do we seek an opportunity to partner so that UFIFIS and Baycare and all of those who are really involved in the nutrition education space would come alongside us? And that's the route we chose. So we've continued to build partnerships for nutrition education. Health screenings are also another thing that happen fairly regularly. And even beyond screenings, we have provided flu shots at food distributions. We've provided access to COVID vaccination. We have done all sorts of other health-specific interventions alongside food. Because one thing we know at Feeding Tampa Bay is food draws people in. More people interact with the nonprofit system because of food or health than any other intervention. And so if we can combine those two together, we're actually providing a fantastic service to the individuals who are in need and coming into our care because we're making their life significantly easier. In addition to that, we also have had the opportunity to provide benefits assistance, to assist with health insurance, with signing up for affordable care, and all sorts of other reasons. And so you see, just in one distribution, we're already working in collaboration. Those are not all things that Feeding Tampa Bay does on their own. And so as we end this series of health equity, eyes on equity trainings, we want to make sure that we highlight that every part of our work at Feeding Tampa Bay is about collaboration and why we would offer ourselves as a partner for any collaboration that you might be in specific to the concept of health and health equity. So as I was putting together the presentation, one of the things I kept coming back to is why Teresa and Allison would ask me to be part of this conversation, specifically around collaboration, right? Because we could talk about health and food in a variety of different areas, but why the focus on collaboration? I touched a little bit on the fact that Feeding Tampa Bay exists in a collaborative space. From food donations that we received from about 100 to 250 different outlets, whether that be public stores or Amazon or direct from growers or canners, or food donations that we receive from the community. Our food gathering process is a collaborative effort. As I mentioned, we have become more and more direct in our client interactions, and that is almost universally done in collaboration, whether or not that is with the volunteers who are there to help us distribute the food, with a partner who might host the distribution, or whatever it is that may be to add to the client experience at that distribution. We do those things in collaboration. We have an extensive partner network, as I've mentioned, and that's an incredibly important part of why Feeding Tampa Bay excels at collaboration, because we don't try to do everything ourselves. We understand and know well the other nonprofits and partners in the community who have expertise that abuts ours. And instead of trying, as in the example of nutrition education, instead of trying to build that foundational expertise ourselves, we're much more inclined to tap into our partner network, call on someone who's already in that space, and bring them alongside. We understand that we can add value in a collaboration. Our value is often access to individuals. I mentioned earlier, we have 1.2 million individuals that we serve across our 10-county area. We often have people who reach out to us to say, I have funding for a new program. Can you help me build up our client base? We have, an opportunity to have an impact in this certain community, and we understand that Feeding Tampa Bay already does work in this community. Will you help us, get in touch with the grassroots or build a partner network ourselves? Those types of things happen to us here at Feeding Tampa Bay on a daily basis, and we're open to them. We love when we get a call to say, will you join us? And I think that openness is a really important element of our ability to be good collaborators. We understand what our value is. We understand what's important to us and why we would say yes to a partnership, but we're very, very flexible as to how we implement that. And so I feel like we have worked very hard to become good partners throughout the community and across a variety of different collaborations and partnerships, because we're willing to be flexible. Do you need home delivery? We can make that happen. Would you like us to draw people in to an event because of a massive food giveaway? We can do that as well. Do we need to tailor responses to specific disease states or specific communities? We'll be happy to work on solutions there together. And so I think that really speaks to our design organizationally, and specifically with the programs team, how we respond. And what I have found over the last 4 years is that without fail, almost always, food is part of the solution. So whether you're running a domestic violence shelter or an after-school program or a ministry out of your local church or synagogue or mosque or whatever methodology you use to distribute food, food is a part of that solution, but food is also really critical to housing. If you're doing a full-time housing program for folks who are currently homeless, you need to feed them. If you have children in your care after school, they're going to want a snack and perhaps dinner. And so we end up being an excellent collaborator, because often what a partner does well, food becomes a distraction, a challenge, just one more detail to mind and to handle. And if we can come in and come alongside, for example, a YMCA, and they can provide aftercare and great experiences for children, and they know we can take care of the food side of their world, then everyone benefits, because we're all doing our own strength. And so those are a few of the reasons why we feel like Feeding Tampa Bay is an excellent collaborator. We're open to collaboration, and we're always happy to take a seat at the table when collaboration conversations are happening. We're an organization that is always looking for how we can better serve the folks in our care and the neighbors in our community. And so I would end the presentation part of this with an offer. I would say to those of you on this call that if there is a moment where you feel like food can assist the implementation of your goals and your priorities, I'd invite you to speak to us. If you are someone who serves or works alongside folks who are in need, I think there are a variety of solutions that we can bring to the table. And we're just getting started. We're building out our team, we're growing our expertise, and we're always looking for ways that we can collaborate with the community.
Thank you, Matt. I do have a question here before we move on. What do you see as the greatest challenge to collaboration?
I would say it's two things. Number one, I think the biggest challenge to overcome is organizational ego. I would say that, and I don't mean that in a pejorative sense. I just mean that when organizations enter a collaboration, it's almost always a challenge to set aside credit, to set aside who gets publicity, to set aside who gets their logo at the top of the page versus at the bottom. It's a universal challenge in collaborations, and it's a really, really critical hurdle to overcome. I think the key way to do that, first and foremost, is put the client at the center of the solution. I think there are a lot of other internal ways that we have to manage our own competing priorities, right? My communications team here wants to be able to tell the story of what we're doing in a collaboration. And they, of course, want to make us a big part of that. It's a very significant barrier. I think we all need to overcome. We all need to continually overcome it. It's not one that you do once and you're done with. The other thing I would say is that we all have our own organizational priorities. We all have our own organizational strategic imperatives. And when we enter a collaboration, it should align with those priorities and strategies. But as we become a deeper part, what makes true collaboration is our willingness to step back a little bit with what our key priorities are to support the priorities of our partners, so that over the long term, in the long view, we can actually all reach our strategic imperatives.
Thank you. I think that's exactly the challenge that I know I've experienced and I've seen. And sometimes I think it's easy to say, but in reality, it is difficult to move, and sometimes just to see that while we know that we have these similarities in our priorities, the immediate work sometimes takes precedence because collaboration and ultimately seeing impact takes time. And I know we all want it yesterday. And really in what we're all doing here with health equity and with food and all of our intersecting issues, that's exactly, it needs to be done yesterday, last year, 2 years ago. So I have one more question before we move on to Dr. Levine. How do you encourage large companies to donate food?
So in all honesty, there are two types of companies that we work with. The companies, corporations, and businesses that are in the food business. And I think there are a variety of ways in which we encourage them to donate food. There are actually a couple of different benefits that we highlight to that organization. Number one, obviously, is the community benefit of that food that would otherwise go to waste being put on the table of someone who could absolutely utilize it, who needs it, and who otherwise wouldn't access it. Secondarily, there is fiscal relief for organizations who donate, right? There are tax deductions available to businesses who donate food or other resources to charity. I think that's a fairly obvious one, but I think it's important to state. But the third one, and the one that we found actually helped us turn the corner with major food organizations, is the cost savings to those businesses when they don't have to pay destruction costs for food that they cannot sell. It's actually a pretty significant cost to restaurants, to grocery stores, to other food businesses when they have to dispose of food that they can't sell. And so we can take that off of their hands. And out of the 95 million pounds of food we distribute, over 100 million pounds of food, 95 million meals we distributed last year, less than 6% had to be destroyed. Nearly all of it would have gone to waste without our intervention. So it's a huge mutual benefit on both sides. And then the last thing I'd want to say, Allison, I think, there's a second part to your question, which is the corporations who aren't directly in the food business. You know, we actually have interesting internal conversations around the businesses who come to us and say, we want to do a food drive, or we want to help to donate to your cause. Of course, we love to hear it, and we're happy to accept it. One of the things that we do for smaller cases is that we encourage those businesses to partner with some of our local partners. When it's a larger donation, like General Mills donating 3 semi-tractor trailer loads of cereal boxes, we'll take that here at the warehouse and then redistribute it. And that's much more appropriate for a donation of that size. But if it's a couple of boxes or even one van full of food, we would really suggest that we would help identify a local partner who might be able to benefit directly from that. What we say to most businesses that we work with is that although the donation of food is important, helpful, much appreciated, and often more powerful to the individual making the donation, a monetary donation to Feeding Tampa Bay actually provides quite a bit more food than the amount you would spend in purchasing the food to donate to us. Through our national distributor relationships and through the other avenues that we have, we can stretch a dollar pretty far in terms of food purchasing. And so we would encourage our business partners to actually donate directly to us. And often our partners do all three. They donate foods to us, they donate funds to us, and they donate their own time through volunteerism.
Well, thank you so much, Matt. I want to move on and invite Dr. Marissa Levine and Matt. We will see you for the question and answers again afterwards. So Dr. Levine, take it away.
Thank you so much. It's so great to be here. And, you know, I thought I had the unenviable job of trying to help put all this together at the end of this series of programs. But Matt, you and Tom and everybody who work and support Feeding Tampa Bay, hats off to all of you. I think Tampa Bay is really fortunate to have leaders like you. And to some degree, you'll make my job a little easier because you've laid out the case study of how you make an impact on health equity. So kudos to you and thank you for taking the time. I've got a series of slides I'd like to show. And I also have a poll. So for this part, if you have your phone handy, or you can do the poll online, get set, and I'll pull up my slides, and hopefully the technology will work. And you should see, you just see my one slide?
Yes.
All right, good. So I've entitled this System Evolution for Health Equity because, quite frankly, if we don't look at it as a system issue, I don't think we'll ever get to where we're trying to go. But I am here to try to help pull it together. I will tell you, you've heard a great case study of something important that's happening in the community, but there is no magic here, and this is hard work. I don't have the answer for you. I think Matt gives you lots of insights into the approach, and I'll try to tease some of those lessons out and help you move along. I will say we're really up against a number of hurdles, and that's the famous quote that you probably have all heard, that systems are perfectly designed to produce the results that they have. So that really tells us that our communities are designed for health inequity because we wouldn't have it otherwise. And people generally don't like change So if we're trying to evolve or change a system, we're also up against just that idea that people really want tomorrow to be like yesterday, because we'd rather have some certainty than the uncertainty that change brings. So the health inequities that exist in the system are what some people call wicked problems. They've been around really much forever, and despite lots of effort and interest, we haven't solved it. So to some degree, it's really ingrained in our day-to-day. But I don't want to leave you on that negative note, because I think a lot of this starts with each of us individually. And you heard that I teach leadership at the university, and I talk a lot with rising leaders about the importance of leading self. So if we're actually going to impact system evolution for health equity, we really have to start with each of us individually, and make sure that we are the best human being possible, that we're fully present, which is a lot harder. Here we are in a virtual environment and we're distracted. I'll come back to that in a moment, because I would ask you to do your best to be fully present with me here. I have no idea if you are or aren't, but you can practice that here. It's something I practice every day because we are easily distracted. I'll be talking, and a lot of the reason I'm putting this up now is this is what I want you to take home, and I'll go into a deeper dive on this. But I'm of the mindset that when you do a presentation like this, you should tell people what you're going to tell them and then tell it. So here's what I'm going to tell you. Leading self is important. These are the components I mentioned about being a human being, being present, being clear on your own purpose and principles, and then finding and living your authentic self, but being adaptable. Change is the constant, so don't fear it, lead it. You need to know the history of the place that you're in, that you're attempting to work with, and embrace it to a large degree so that you don't repeat the things you don't want, and you move forward. And then you have to see the larger system because of the connections and relationships. Collaborations don't just happen. They're part of appreciating that larger system, if you will. I think it's better to be positive, to take a strengths-based, asset-oriented, if you will, and a collaborative approach, which Matt talked about. And then the hard work here is that you've got to prepare yourself, practice, keep learning, then adapt, but you have to keep learning, then adapt over and over again because of change. And at the end of the day, don't forget to inspire hope in yourself and others. So I think these are key principles of leading self that I'll come back to. And my key messages for the day really evolve from that we have to challenge our beliefs, our assumptions, our mindset, if you will, both individually and collectively. And at the end of the day, nothing will change because we don't want to change unless we have taken upon ourselves to change and to challenge the way we think about the world. We can work together, as you heard Matt talk about, to create that shared vision. I'm going to talk about using a well-being focus. There are lots of advantages. It's something up and coming, and I think it fits nicely with what you heard from Feeding Tampa Bay. Well-being allows us to take a very inclusive approach in our communities, thinking holistically, working upstream. There's a quote that I'll show in a moment that really it's about appreciating that bigger system, if you will, and its impacts. The world is changing, I mentioned. The change is the constant. And then I'll show you some tools, some simple tools you can use in your work that might help you look at the world differently and see opportunities that you might not have seen before. I'm not going to make you an expert, but I'll introduce you to them, and they'll be available in the slides when you get them. I think that that focus on well-being is about equitable well-being in our communities, and it gets you to think holistically, what I call thinking in systems, what many have called that. And at the end of the day, with this approach, you can create the conditions that allow a future to emerge that actually has a better opportunity for unleashing the collective passion, wisdom, and intelligence that exists, but isn't always utilized. So my goals today are really very simple in the time that I have with you. I want you to think differently. And I'll share some simple tools, as I mentioned, but I'm a firm believer that the thinking differently is the root issue that we need to work on, and we can help one another to do that. The first thing I'd like to do in terms of thinking differently is to get you to appreciate this concept of well-being with a very simple scale. And I'll actually poll you about this. This goes back many years from Dr. Hadley Cantrell. Many of you are probably familiar with the Gallup survey. Gallup does a well-being poll, and they use this as part of their well-being assessments. So it's very simple. If you imagined a ladder upright in front of you, this says with its rungs labeled 0 to 10, 0 at the bottom, 10 at the top. My poll will actually have 1 as the lowest rung. And there are two aspects to this. One is that, first of all, the top ladder represents the best possible life that you would envision, and the bottom rung, the worst possible life. So you envision where you are on that ladder, on which rung you're at. And I'm going to ask you to think about where you are today and then where you see yourself in 5 years. So very simple. Again, a ladder is in front of you. It'll be from 1 to 10. 1 is the worst possible life, if you will, and 10 is the best possible life. So this poll is very simple. You can do it on your cell phones. On the cell phone, you just text to 22333 and enter the word Marlev, and it'll tell you that you're in the poll, and then you'll see my questions and you can respond to each of them. Or you can go to the web, pollev.com/Marlev, and you'll actually see the questions and then can input your answer. This will be on the top of each of the slides too. And so if you just take a moment, if you want to participate, it's all anonymous. Your name will not come up, and we'll get a sense of what you think. I'll do a couple more questions in addition to the well-being, just to get some insight from this group. And the first question should pop up. This is a word cloud, so I'd like you to just choose one word that best describes a successful community. Good, I have at least one person listening. Oh, 2, thank you, 3. We'll let it form for a few moments. So right now, all of these words are pretty much equal. We'll see inclusivity is coming up. These are all powerful terms. Equity, equitable, flourishing. Well, good. I appreciate you sharing your insights. I'll let that flow for just another second or two. Great. So inclusivity is kind of front and center, but there are a lot of similar words, and I would say all really positive, powerful words about community. Thank you for doing that with me. So now we'll go to the ladders. And this is ladder present. So on which step of the ladder would you say you personally feel you stand at the time? And remember, 1 is your worst state and 10 is your best state of well-being. I think it's really interesting to do this in the middle of a pandemic, and I'll explain why in a moment. I've done it with a number of groups, so we'll see how this group compares. I'll give it another couple seconds. So generally, you're skewing toward the better place, which is good. Nobody's coming in at 1 or 2, which makes me feel a little better. This has been pretty typical in what I've seen. I've done it with students. I've done it with community groups. And given the fact that we're in the middle of a pandemic here, I think everybody is feeling some degree of stress and angst. So it doesn't surprise me we have a range of findings kind of in the middle to toward the upper scale. So now I'd like to ask the same question. Where do you see yourself in 5 years? on the same ladder. Remember, 10 is your best well-being state and 1 is your worst. And you're already seeing a difference because now we're skewing toward the highest end. I'll let it run a few more seconds. Thank you for everybody who's been participated. I appreciate it. And again, this has been pretty typical through the pandemic. There's hope, and that's really important. One of the reasons I put on the leading self slide at the bottom, inspiring hope is critical. So assessing your own hope is really critical if we're going to work on health equity as a community, because inspiring hope that we can get to someplace better, I think, is a really important part that we each play a role in. And I'm glad to see that this group also has hope that your own well-being will be better in 5 years. We're going to need it. It's going to be a challenging few years. I don't have a crystal ball, but I know we're going to be challenged pretty much every year for the next few years at least. And so we're going to need all of our resilience and all of our grit to move forward. And then I have one final question. And the question to you is, I believe we can create an epidemic of health and well-being in my lifetime. Yes? No, not sure. A, B, or C. A is yes, B is no, C is not sure. And I may have to come back and show you these results because it's not showing me your results, even though 13 of you have responded. So I'll look at that toward the end and see what we got. So this concludes the polling. And again, I want to thank you for doing that. I would ask at this point, I don't know what your answer is to this question, but I say it's very important to have the belief that we can do this. It's going to be critical if we're going to impact health equity. And quite frankly, going back to mindset, if you don't believe it can happen, then there's a much less likelihood that it will, which is why I asked the question. So we'll see what the answers are moving forward. So I had mentioned about thinking holistically, and this proverb, I think, is really important to what I'm trying to get across for the rest of the session, that we do a pretty good job of appreciating our world, if you will, in the world that we can see, but we're not clear on how much the world beyond us, both in time and space, impacts us. And this is why it takes additional energy, to think holistically, because it's easy to stay in your little bubble, however you define that, and feel like things are fine. But I think Matt gives you good evidence why it's so important to reach out beyond your own boundaries, or the boundaries at least you've made for yourself, and think bigger. And so I think this proverb is really telling. I will tell you, apropos of the last poll question, Jonas Salk was quoted as saying, it is possible to create an epidemic of health. And he believed it. And I think to a large degree, that's why he could be so successful in creating what turned out to be a polio vaccine that was critical at a time when people were dying and being maimed by a scourge of a disease, not unlike what we're having now. So mindset does really matter. So that's part of the leading self part that I wanted to emphasize. I want to start talking about the evidence for moving forward as a community on impacting health equity. You've all, through this series, you've learned a lot about the social determinants, the causes, if you will, of inequities, the impact. Now we have to talk about what we're going to do about it. And Matt's story, I think, is a wonderful example of what could be done with the groundwork laid of an amazing community foundation to build on. So the National Academy of Sciences put out a report in 2017, Communities in Action, Pathways to Health Equity. I would hope some, if not all of you are aware of it, but I wanted to at least bring it to your attention. This was kind of their summary diagram that emphasized the social determinants and the solutions and the fact that these are structural issues, if you will, with deep drivers. But they also identify in the center here the elements of community action that seem to make a difference. And so I think this teases out nicely from Matt's presentation. I wanted to summarize the report and encourage you, if you are not using this or familiar with it, to take a deeper dive. But the key elements for community action are multi-sector collaboration, as you heard. And I think the multi-sector is really critical. We can't impact health equity by health entities alone. That you have to have that shared vision and value. So despite your organization's particular vision and value, can you be part of a larger community vision on health equity and define what that is? And then you have to look at the capacity to actually impact outcomes. And I put in quotes here right from the document how they defined community capacity. So it's really about being able to come together to identify those common needs and to bring people both from inside and outside the community to leverage and align their efforts. There are some qualities of the organization that are particularly impactful that have been studied and demonstrated, such as committed, charismatic leaders like Matt and Thomas, for example. Community support, as you heard, for Feeding Tampa Bay and other resources available. And then obviously the alignment with the larger social, economic, environmental, and political conditions. That it's really hard to impact change if you don't have that. There were some additional success factors in this report that I think also are highlighted by Matt's presentation. You've got to have a partnership size and diversity that you manage, so you have to be very intentional about it. Can't let it get out of control, for example. And you have to have multiple approaches to leadership. You really want to create conditions for leaders to develop and operate at all levels of your organization, grassroots and beyond. And it's important to maintain focus. I think one thing I love about Feeding Tampa Bay is they know what their short-term focus is, but they also have the long-term vision of ending hunger and hopefully putting themselves out of work at some point. But having that focus is critical because it's easy to drift or be pulled if the collaborative isn't as focused as it needs to be. Conflict is always an issue. So this is a leadership capability to be able to lead conflict resolution and then manage it. There are life cycles to these activities. They wax and wane. People come and go, and you have to deal with that. You have to recognize it happens and work with it. It's just a natural cycle, if you will. And so be prepared for it because it will happen, and you need to think about how you sustain the effort. And then something every community does is a patchwork of resources. Quite frankly, because our communities are not designed to do this work. So we have to use what we have, deploy and redeploy, and then patch it together. And I think that's the art of leading this kind of system evolution. Sometimes frameworks matter too. And one thing I wanted to bring to your attention was that the UN created Sustainable Development Goals. Many of you may be familiar with this. This is really from a global or a national perspective. But what's intrigued me recently is that many communities around the world are starting to use these development goals as a framework for their action. So for example, the good health and well-being number 3 encompasses a lot of what we're talking about here today: health equity, health for everybody. And you can, as a community, focus on one or more of these. They're all interrelated and connected, but it may help you to align efforts locally with work that's being done both nationally and internationally. And I'm intrigued about this. It's an evolving arena, but I was really interested to hear that there are many more communities who are embracing an approach like this. And at the end of the day, I think the important thing is to have a framework that you work within. And I'll come back to the issue of boundaries in a moment. The other thing I would ask you to think about is really comes from Peter Senge, and those of you who may be familiar with the 5th discipline work. about learning organizations. This is hard work, and nobody's written a manual. Even though we have a National Academies report, it's not a manual. It's not a playbook, if you will. Every community is going to have to figure this out for themselves. And so if your organization and the larger community can learn and adapt together and understand what it takes to do that, then I think we have a better chance of figuring out what works in the Tampa Bay region, for example, because the context matters, and how you do things here may need to be done differently someplace else. So Peter Senge, I've highlighted his disciplines of a learning organization. I'm going to talk a little bit more about systems thinking, and mental models I've already talked about. Shared vision, you've heard. Personal mastery is something we have assumed that we're competent in doing what we're doing, but this is an arena that's still evolving. And so we have personal mastery still to develop, because we don't necessarily know all the skills necessary. And the team learning piece, I think, is critical. In fact, my hat's off to all of you for learning here. Hopefully, with whatever organization you're in, you have an organization that values that learning, first of all, and team learning, because team learning is what gets us to be able to move in an aligned fashion toward a shared vision. So I encourage you to make this more intentional, and don't just let it happen. Be intentional about building a capability to learn and adapt on an iterative basis. Now, remember, we're talking about not what are called inherent problems. We're talking about emergent problems here. So we're really good at dealing with inherent problems. That's problems of the parts of a system. We can focus really well. In many cases, we have the book, we have the playbook for what to do. But we're talking about emergent problems that are problems of the system as a whole. Health equity in our community, or health inequity, is a problem that emerges from how we are set up, how we operate, what we believe. And so we have to deal with these very differently. I would say that the emergent problems can't be understood just by understanding each of the parts. So we have to understand better the dynamics of the whole system and appreciate the history, as I said before. I'm always impressed as I've learned more and more about issues like this, that often they're very simple rules, if you will, or simple patterns or behaviors that result in these very complex outcomes, like health inequities in a community, for example. And I thought a lot about this, and I think 3 simple rules that get us to where we are today with the health inequities would be something like, there is a belief, whether you want to hear this or not, that people are not all equal. That's an underlying belief that exists. And the action that results is that people are treated differently as a result of that belief. And it gets reinforced then, the 3rd simple rule, by making the outcomes less visible to the larger population, or working effectively to keep it invisible, if you will. And I'll let you ponder those. But on a positive note, there could be 3 simple rules for enhancing health equity in a community, if you think about it the same way. And the first would be that we challenge our mental models, and we assure that we believe that all people are actually equal. That as a result of that, our action is that we treat one another as that person would want to be treated. Not even the golden rule. This is the platinum rule. Treat others as they would wish to be treated. And then that gets reinforced by distributing power more evenly throughout our communities and the resulting system changes that occur. So it doesn't have to be complicated, but saying that doesn't make it happen. But appreciating it, I think, is the beginning. Because I'll channel Albert Einstein, since you heard I went to Einstein Medical School, that I really think we have to think differently if we're going to survive and move forward. We're at a pivotal time in many ways. And when it comes to issues of equity and health equity, we know that the thinking that got us here isn't going to be the thinking that gets us out of it. So I think we the different thinking that's necessary are things like focusing on our strengths and our assets, that positive approach, thinking in systems, that more holistic approach, and then taking a well-being perspective. And I'll cover those briefly in just a moment. The first one is the positive strength-based approach. We should really take advantage of the fact that David Cooperrider owns property in the Tampa area. He's the founder of Appreciative Inquiry, and there's been an effort in the community to try to build a tipping point of activity around appreciative inquiry. And very simply stated, it's taking a positive approach, inquiring from a positive perspective about where we are, what got us here, what's the vision we want, what are the root causes of success, so that we can use design thinking and move forward. And then what do we need to do now to reach that destiny, that vision of the future, where we have an equitable, health equitable or well-being equitable community. When you think differently this way, I've found in my work teaching leadership that it's very engaging in a positive way. This positive energy is something that people want to connect to. And it helps you, it doesn't minimize the problems, but it helps you stay in a very negative spiral space where only a problem focus causes you just to go in a different direction, and it wears people out. And one of the ways that we've been worn out is by how we take our strategic planning, which is something we really need to do if we're going to think strategically about how to move forward. We often take a SWOT approach: strengths, weakness, opportunities, and threats. And any of you who've done that know it's an okay approach, but we end up always over focusing on our weakness and our threats. So appreciative inquiry actually has a better way, I think. We call it SOAR, where you can take your strengths, imagine your opportunities, innovate to meet your aspirations, and then use your inspirations to get results. So it's still results driven, which I know is very important in this day and age, but it just starts and then takes you through a much more positive approach. And I have a number of anecdotes of people who've used this approach with their teams and have found a much more positive, engaging environment. And it unleashes creativity and innovation that might not be before. So I think the Tampa Bay region has a huge opportunity from a mindset shift to build on what's been started here with appreciative inquiry. Think about using tools like the SOAR framework moving forward as you do your collaborative work, and see what happens in terms of your engagement. I'd love to hear if you initiate this, where it goes. Part of this too, in the thinking differently, is something we call double loop learning. And let me just say, what we typically do is on the right side of this, where we have an issue, a problem. We come at it from whatever values and techniques, action strategies we have, put it into play, put some solution into play, see how it works, and then tweak it. And we kind of stay here, just keep at tweaking what we're doing. And what we need to do for these kind of issues, which are those wicked problems, health inequities, wicked problems, is we have to come back and get past our own defensiveness and challenge our underlying beliefs and assumptions. Because with that produces opportunities that we wouldn't have necessarily thought about before, and gets us out of what allows us to get stuck in the thinking that got us here. So double loop learning, I think, is an important aspect of changing our mindset. And then the systems thinking, I have a definition here from an article and a graphic of it. I won't dwell on it, but it, simply put, it's a synergistic group of skills, and when they come together, they're actually a system. I think there was a paper by John Sterman about in 2006. He described systems thinking as an iterative learning process in which we replace a reductionistic, narrow, short-run, static view of the world, which is typically how we evaluate things, with a holistic, broad, long-term, dynamic view that allows us to reinvent our policies and institutions. So I think this is why I keep harping on this. It's a more holistic approach. And the graphic here is just for your review. I'm not going to go into detail, but when you become a systems thinker, and you may be already, you actually start thinking about the system structure and understanding it, realizing it's dynamic, and understanding that a given input doesn't necessarily result in the corresponding output. So a small change in the right place at the right time in these, what we call nonlinear systems called communities, could have a huge impact. And a big program that we expect to work may fail because it gets buffered by the system that doesn't like to be changed. We can model. That gives us greater understanding at all levels of our community, for example. And the idea here is that we come up with some different approaches. We may not be good at predicting, because I don't want to harp on the fact that systems thinking will get you to better predictions. These are very complex systems we live in communities here, and you can't always predict what can happen, but you have a better chance of decreasing unintended consequences and greater probability maybe of going in the direction that you would like to go. Now, let me just say, you have to appreciate what a system is first. And very simply, this was the godmother of systems thinking, Danella Meadows, said that basically a system is made up of three things: the parts, the elements, and in a community, that would be each of us. The interconnections, that would be in our community, would be our relationships, and some function or purpose. And unfortunately, I have to say that the function right now is to perpetuate health inequities. We would like that function or purpose to be to sustain health equity, but we have to be really intentional about that. So we do have a community system, we have organizational systems, we have political and social systems, and they all interact. And if you have something that has parts and connections but serves no functions or purpose, it is not a system. So very simply put. Now, if you start thinking this way, then we can channel Buckminster Fuller, who said you never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. So to me, that says, let's build a community that is intentionally designed to promote health equity. And let's focus on that and not fight the existing reality and just tweak it, but let's build something bigger, better, and allows prosperity and well-being for all people in the community. To do that again, to channel John Cania, some of you may know that name from Collective Impact, the transformative change that's needed will only come about if we make sure that we're challenging our mental models. We frequently work up here, we do policies, practices, and resource changes. Feeding Tampa Bay, I think, has worked in all these spaces, but at the end of the day, we have to challenge our mental models and think differently. And that's something each of us can do, and we can help one another do to move forward. So what I'd like to do is show you some other ways of looking at systems, not because I expect you to be experts in this, but just so you know that there are other tools available, and there are people who can facilitate this kind of work. So as you're thinking about moving forward, you might consider finding people who are who can help you create system maps, system constructs that add some of the dynamics to this and some of the feedback loops. So I'll show you one example, because there are patterns in communities that exist that when you start looking at it differently, just become obvious. So this is called, this particular pattern is called success to the successful, which I think fits perfectly with what we're seeing in terms of inequities. This is a dynamic. These two loops are called reinforcing loops. So what happens is the components here are reinforcing the outcome in each loop. And so we have two populations. We have a population A and a population B. Population A gets more whatever resource, let's just say money, added than population B, because it's generally starts out with opportunities to be successful more so than population B. And so resource allocation keeps going to A. but it's getting taken away from B. So success, less resource means less success in population B, and it just gets reinforced here. Success reinforced here, lack of success reinforced here. And when you put it on a graph over time, then basically you see these two groups diverge, which is a very simple dynamic and portrayal of what happens in communities with health equity or equity in general. And it will continue unless you do something about it. Those forces need to be balanced. There's another feedback loop called balancing loops, which can stop the reinforcement or mitigate the reinforcement of things that you don't want to happen. But until you start looking at the world this way or thinking this way, you don't necessarily know where the leverage is to make those changes. So if we don't do anything, it continues. We may narrow the success differential here, but it will continue to go on and on. And the point here is these are dynamic, these are ingrained, and it's going to require energy and intentional effort to change it. Now, there's another dynamic that I wanted to bring up, because frequently when you have lots of organizations working toward seemingly the same purpose, over time they become what are called accidental adversaries. And this one's a little more complex, so I'm not going to read it all to you, but the simple message here is that this is COVID, right? For example, politicians are over here on the left and the public health people are on the right. What happened in COVID is, in the beginning, the politicians and the public health people were working together. So the outer circle is what we saw happen and what we wanted to happen, where we had clarity of policy decisions and coherent, effective public health actions, and it reinforced itself until such time as, and I'm not picking on anybody, but I think this is fair to say, politicians or some politicians realized that it wasn't necessarily in their best political interest to keep doing what they were doing or keep supporting the public health message or efforts. And so these inner circles here on the left side is just saying, now we have a balancing force that's actually undermining the forces on the right in the public health arena. And so the public health arena respond, and both efforts start to undermine one another. So I bring this up here because it's easy for organizations and communities that are seemingly working toward the same goal, because of, I think, Matt, you said it well about organizational ego. You start going on a different path, and without realizing it, you're undermining your partners, and you become these adversarial, accidental adversaries. So these are very dynamic, and I think if you don't stand back and see the bigger picture, then you're not going to make a change. So for the success to the successful, the way you deal with that is you have to have some kind of redistribution mechanism, however you want that to be. I mean, taxes and other supports are ways to do that. Here, the work requires that you overtly clarify the benefits of both of the partnership to both parties, and really bring it to the forefront here if you unintentionally ended up becoming accidental adversaries, that it was unintentional and you need to work on it, and then build supports in to help the groups work together. So I think this is important in terms of health equity, because there's a lot of activity happening now in the Tampa Bay region and many other places, but we may actually be accidental adversaries to one another without realizing it. And it's an important time to step back and really appreciate and ask yourself the question, what am I doing that might undermine the whole process and also my colleagues, partners, or collaborators? So that's another way to think differently. And then the third way is the well-being piece. And I just wanted to bring to your attention, and I think many of you may know this, but Robert Wood Johnson, for example, this is a recent publication, has certainly been pushing well-being in its culture of health approach. And well-being is an emerging concept, particularly collective well-being, where we're talking about the well-being of a population. What it offers us for this health equity work is that a focus on equitable well-being or population level well-being allows us to take an equity focus. You can't do this work without taking equity focus. It's more human-centered because only individuals can tell you if they're well. I can't tell somebody else if they're well. They tell me and they define it. And it allows us then also to be holistic, because now we're not just talking about physical health. We're talking about physical, emotional, social, spiritual, economic, financial. All of those are components of well-being. And that then allows us to do that multi-sector work that we need to do, and builds the interconnections or the relationships. So I think that mindset leads people to do what Matt and Thomas have done, which is reach out and be open to many, many partners. So for Tampa Bay, here's some questions to consider, because when I say the public health system in 2021 post-COVID, I don't just mean governmental public health or the healthcare arena. If it's not clear to you, I hope it is, but COVID has demonstrated that everybody has a role in the population or the public's health. And we have to come together and figure out, okay, what is the purpose of this community system, if you will, that impacts health? Health no longer and well-being are no longer just the result of our individual actions. I hope that's clear. It never has been, but it really is, as you've heard for the number of weeks that this program has gone on, impacted by so many factors in a very complex way. I like to think of health and well-being as emergent properties of these systems. And so we have to ask, what's our purpose here? I hope it's equity. I hope it's about collective well-being. I hope it's focused on prosperity for all. And how do we set it up so that it provides some value? How do we keep people engaged? How do we help people know what their role will be? And how are we going to create a community that's intentionally designed for health equity? And in doing so, as I hope I've made my point, how are we going to make sure we challenge our underlying assumptions and beliefs that keep us locked? So I see each of us here as leaders. Everybody has a leadership role in this work. And the job of leaders, according to Peter Nordhaus, who's a leadership guru, is to produce change and movement. I like to say it's to adapt to change, because change happens sometimes faster than others, and produce movement. And it's done by establishing direction, aligning people, and motivating and inspiring. So setting the vision, as you heard Matt and Thomas in Feeding Tampa Bay, aligning people through commitments and measurable outcomes so that we know we're there, and then empowering and inspiring one another by having environments of safety and trust. This is the work that leaders need to do around health equity and just leadership in general. If we want to get to system evolution, we can follow the path that David Stroh has laid out in his book, System Thinking for Social Change. And a lot of what I've done up until this point is focused on this stage one here, where we have to be ready for change. We have to build a foundation, which is not easy. So that foundation starts with us each individually and then works in our organizations and collectively across the community. And when we have that foundation, we can really face our current reality and understand it. What's the history of what got us here? What are the dynamics that keep us where we are? And begin to get some greater insights, like maybe through those system maps that I was showing you. We have to then, once we've come together and we have that trust, make a commitment of where we're going to go. What's our vision? What do we want this community of health equity to look like? And then once we know our reality and our vision, we've got a gap there which the arrow identifies. And we can begin to talk about how to bridge the gap and move forward. This is the basic construct for system evolution. I think I've made it busier on the next slide with my own inputs. I won't read them all to you, but I just want to say at the bottom is the readiness work that we need to do. And I emphasize purpose because we don't spend enough time always clarifying what our purpose is individually organizationally, and then collectively as a community. So we need to be clear, because otherwise things will just happen. And under what foundational principles are we going to work? They ought to be, in my opinion, ones of morality, equity, diversity. I hope it would be positivity with a can-do attitude, a growth mindset that takes a strategic approach, meaning we're not just working in the short term, but the long term, and that we value positive relationships, and it's got to be sustainable. We can't just do it for a grant for 3 years. This is about leaving it for the next generation in a better place. This you may or may not have heard, but bottom line is context matters. And we, right now in a pandemic, we live in a very complex world, very complex context. There's a systems thinker who I really respect, David Snowden, who created something called the Cynefin framework. It's a Welsh word, it means habitat. And what he's trying to do here is get us to stop and appreciate the context where we're operating in now, because how we do things should be different in different contexts. And I will tell you, just as an example, in the very beginnings of the COVID pandemic, it was a very chaotic, if not totally disordered and panicked context. But in a chaotic context, you have to do something, because you don't want to stay in a disordered or chaotic place long. That can lead to really bad things. So the fact that we took action immediately was really good, because it got us to something a little more manageable. I would say a complex context. And in there, again, you don't have a playbook here. You can't just pick up a manual and say, here's what you need to do. You have to probe and try things and then see how that works, and then augment those things that seem to be giving you positive result. David Snowden says when you're in this arena, there are only 3 things you can control. You can set the boundaries, which is why I brought up issues of framework. So you can decide what boundaries you're going to operate in, realizing that they're artificial and they'll be impacted by kind of the larger context. Then you've got to probe, you've got to try some things, see what works, and then amplify those things that seem to be working. So the bottom line is, we don't have a playbook for health equity in Tampa Bay. We have to figure out as we go. And as long as we're in this complex environment, particularly with the pandemic, we're going to have to try things, but continue to learn and adapt, and then augment those things that seem to be making a difference. This is why the collaboration and the feedback is so critical. Real-time understanding of what's happening and sharing is so important to making this work. A lot of the day-to-day work, so Matt and Thomas and the people at Feeding Tampa Bay can do the day-to-day work of collecting and organizing and getting food out, because that's in complicated. There are lots of moving parts, but it's doable. They know how to do it. And we have to be really careful that we don't assume we're working and living in a simple environment where we think we know exactly what to do, but in fact, we're in a complex environment and we have no real clue of what works. So I think the value of this framework is getting you just to stop and get some sense of what context you're operating in, because we have to work differently in those different contexts. Regardless of where you are, collaboration is the key. And the more we can learn how to do collaboration better, the more we can learn from people like Matt and Feeding Tampa Bay, the better. Because at the end of the day, the collaborative has to articulate whatever they're working on, understand that current reality, like the STRO model, vision where you're going to go, identify the boundaries we're going to work within, because if you don't, you'll drive one another crazy. And then think about what it is that we are going to do moving forward. What's our hypothesis about what might work? What insights do we get just by being together that help us appreciate a potential path forward? And make sure, I don't think I have to say this to this group, but make sure that you have the right stakeholders present, the issue owners, the gatekeepers, people with the power, if you will, and then people who can help you model. And remember, we're in a pandemic, so we need leaders of leaders who can look at the whole situation and connect not only with the people they have to lead, but beyond and lead up and across. And one of the nice things about this approach is that this meta leadership concept helps us remember very simply, when we identify the gaps in our community, somebody always has something to give, but they may need to get something to give that. So Matt may have food to give, but they may need help with identifying sites, for example, as he mentioned. Something very simple to keep in mind. When you get together with people, make sure it's a conducive structure, a place. There are lots of different approaches. Some of you may be familiar with World Cafe and open space, but whatever you do, make sure it's trusting, that you set your boundaries, you have a focusing question, you think in systems and create maps, and consider that doing this, you might find some leverages, places to leverage. And there are lots of different ways to leverage. This is a long list from Danella Meadows. And at the bottom of the list are the most impactful. And you'll see mindset number 2 on there. When you can get people to change their mindset, that's the most impactful. The leverage points, more simply put, would be what's keeping the system status quo as it is. Whatever's enforcing and reinforcing that is where you want to operate. You can either balance it or interrupt those reinforcing loops. This may be a more simple way to do it. Whatever you do when you come together, it's not creating the maps or the designs, if you will. It's what insights you gain together, what relationships you build. So I'll leave you with one final tool. When you do come together, many of you are familiar with the iceberg concept, where whatever's happening, whatever we can see is literally just the tip of the iceberg. The patterns of behavior, the system structure, and how we think about things are what's really driving what we see above the iceberg. So you can use this metaphor when you're doing your collective work by first focusing on what's happening currently. What do we see? So we see health inequities. You can focus that. What are the patterns that drive that? What are the system structures, the political system, social systems, transportation systems, whatever? And what assumptions led us to all of this? You can identify that, and then you can envision where you want to go and do the same thing. What assumptions, what beliefs do we need to have? Structures do we need to put in place? Patterns, and what are we trying to accomplish? What's that vision we want? And you can do it best, I think, not with words, but in pictures. These are some examples of rich pictures. They capture much better lots of different perspectives. And if you do it, you can include all of these components. And so those are just some very simple things you can do. I would say, remember, we're in a pandemic, and our mental health really matters. We need one another when we work together. So I want to close by just saying, please take care of yourself and others. This comes from the National Institute of Mental Health. Remember that hope matters. And as Charles Revlon said, in the factory, we make cosmetics, but in the stores, we sell hope. So I thank you. I ask you to channel your inner strength and caring, find your courage, collaborate, do some good, be well, and stay safe. And Allison, I'll turn it back to you.
Wow, thank you so much, Dr. Levine. So much to digest, and such incredible tools to wrap up and to look at what we can do. First, I want to thank you, Dr. Levine, and Matt, thank you so much for your presentations today. I think that it was the perfect way to wrap up. This is our last session of Eyes on Equity. And I want to thank, of course, our presenters today, our presenters for all 6 of our sessions. I will be sending out the PDFs of the presentations from today, along with a recording in the next few days. And while we leave each other at the end of these 6 sessions, and I thank you all for joining us, at whatever point you've been able to, and know also that we will be sharing the links from the other sessions as well. And I want to leave you with this, and that is this should be just the beginning of really taking what we've learned over the last, well, really 6 months, because we've been doing one a month, and come together and figure this out. And so after we close the webinar today, you will see your survey. Please do complete your survey. And in there is a couple of places where you can, of course, share your thoughts, but also I invite you to connect with us in your interest, your ability, and what direction you want to see this go. We will be following up with whatever direction, whatever comes next. And we want to listen to what you have to say to figure out what that is. So whether it's in the survey, which again, I certainly encourage you to take, or you want to reach out to me directly, please do. And finally, a big thank you to Baycare for supporting all 6 of these sessions. And I have to say, it has been a joy. So thank you all so very much. And I look forward to what comes next. Have a good one.